I'm Austin.
I'm Diana.
My name is Marlena.
And we're Cypress College students giving you a tutorial on what to do in life-threatening situations.
Today we will demonstrate a set of skills which include adult CPR, conscious choking for a child, prone to supine roll, two-person seat carry, and asthma.
Now I will be discussing adult CPR. When the first responder arrives, it's important to quickly check the scene to make sure it's safe. Next, you check the victim. Tap the victim and loudly ask, "Are you okay?" to check for consciousness.
Sir, are you alright?
If they make no sound, the next step is to call 911. Give the dispatch the exact location. Keep in mind that if you assign someone to call 911, make sure to tell them to get back to you to confirm they called.
Call 911. We have an adult male unconscious at Cypress College next to the men's shower and locker.
After calling, you check for signs of life. Place 2 fingers on the chin and the other hand on the forehead. Slightly tilt back the head with your ear near their mouth to hear for breathing, while also looking toward the chest for any rising. You do this for 10 seconds.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
After that, you're ready to start CPR with a cycle of 30 chest compressions and 2 rescue breaths. Place one hand on the center of the chest and place the other hand on top, interlocking the fingers. Keep your arms straight and perpendicular to the body. Compress for at least 2 inches.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 2, 3, 4, 5, 6, 7, 8, 9, 30.
For the rescue breaths, place the mask over the nose and the mouth. Retail as before, giving 2 rescue breaths. If the chest does not rise, give 2 additional breaths.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14.
Do not stop CPR unless you find an obvious sign of life. An AED is ready to use. Another trained responder comes into the scene. You are too exhausted to continue, or the scene becomes unsafe.
The next scenario is conscious choking for a child. The first step is to ask the parent for consent to assist their son or daughter. Make sure you introduce yourself and inform the parent that you are CPR certified.
Hi sir, my name is Marlena Balcazar. I am a certified first responder. May I assist your child?
Yes. The next step is to call 911.
911, I have a conscious but choking child here at Cypress College.
Then, for a child, you would need to go on your knees, place yourself on the side of the child. Bend the child forward at the waist and give 5 back blows between the shoulder blades with the palm of one hand.
1, 2, 3, 4, 5.
Next, place a fist with the thumb side against the middle of the child's abdomen, just above the belly button. Cover your fist with your other hand. Give 5 quick upward abdominal thrusts.
1, 2, 3, 4, 5.
Continue the same cycle until the object is forced out, or the child can cough or breathe, or if the child becomes unconscious.
1, 2, 3, 4, 5.
If a child becomes unconscious, call 911 if they have already not done so. Carefully lower the child to the ground and give care for an unconscious choking child, beginning with looking for an object.
The next scenario is prone to supine. First step, when you arrive at the scene, you ask the victim if they are okay.
Hey sir, are you okay?
Then call 911.
911, I have an unconscious male victim here at Cypress College by the TE2 building.
Then position yourself behind the head of the victim. Place the arm closest to you straight out above the head. Place the arm furthest from you out to the side. Then place your hand gently on the victim's neck and waist. Then proceed to gently roll over. Pull the victim toward you. Monitor for signs of life for 10 seconds, no signs. proceed with CPR.
Alright, next is a two-person seat carry. This carry requires two people and can be used for any person who is conscious and not seriously injured. First, grab the arm of your partner closest to the victim. Interlock them. Bend below to the victim's lower body and pull the victim's arms over your shoulders. Place the other hand across the victim's head. Hoist and carry the victim. Responders should coordinate their movement. This is a two-person seat carry. Lastly, we will inform you how to give care for a person who has asthma. Asthma is a breathing emergency where inflammation in the body occurs, restricting an airway. Signs can include trouble breathing, sweating, being able to talk without taking a breath, having a tight feeling in the chest. To give care, help the person get as comfortable as they can by having them sit. Try to calm and reassure the person that it will be okay. Ask the person if they have a medical condition.
Are you taking any medication?
If they have an inhaler, check the expiration date and assist the person to take it. If they don't, try to continue to calm the person to get back to normal breathing. Monitor the person and care for shock if necessary. Call 911 if breathing troubles continue for an extended period.